Imagine the situation. There's been a natural disaster, something totally unexpected and absolutely devastating. An earthquake, a tidal wave, a cyclone. This kind of thing does happen tragically, and when it does, nothing normal works. The roads are smashed to pieces, so communications are very, very difficult. Logistics are impossible. There's no banking system because the banks are in ruins, and there's no electricity to drive all those ATMs anyway. There's people queuing up for food because there's no food around. There are real problems of disease, risks of all kinds. Under these conditions, life is not normal. But we have to do something. And under those crisis conditions, the great news is we do. In the humanitarian sector, there's a long tradition of innovation, and a tradition which to this day is generating not only very powerful solutions to these problems, but also often very different solutions. One of the characteristics of crisis innovation, what I call crisis-driven innovation, is very often the crisis blocks the normal things that we would do, and we have to come up with a different approach. Crisis-driven innovation essentially is the ultimate demonstration that necessity is the mother of invention. You have to do something different. You can't leave people to starve. You can't leave people with diseases. We have to do something. But what also emerges under those conditions very often are radically different routes. What happens very often is that the roads, not just physically but also metaphorically, the roads are blocked, so we have to find new routes. And this is very much again a characteristic of crisis-driven innovation. Recent research suggests that very often, because the existing conditions are so different from the normal ones, the traditional set of solutions are inapplicable. It forces a hunt in new directions. And that's a very powerful source of innovation. In a sense, the world of crisis is a very different world, and one where the context is very much complex, uncertain. There's no clear solution, so more than anything else, this is a space in which we have to experiment. Now, here's a picture to try and put that in perspective. Imagine, first of all, the left-hand side, the vertical axis. What we have is our traditional picture of innovation, from the incremental, doing what we do better, to something completely different, something radical. And on the bottom axis, some measure of the complexity in the environment, the things that are going on, the things that we have to take into account. Now, on the left-hand side, we can think about an established frame, business as usual. That's not to say we don't need to innovate, but the context in which we innovate is stable. We know the kinds of problems and we have some idea of where the solutions might be. If we're talking business, we know which markets to watch, which customers to listen to, which competitors to watch. But on the other side, that green area, it's very different. It's unexplored territory. It's where new elements come in the frame and where we might need to find very different solutions. Now, if we think about innovation management, we know a lot about the first two areas. We know a lot about incremental innovation in the space we're familiar with. That's really a matter of deploying solutions we already know about and improving on them. And we know how to move in bigger steps towards a frontier where we're clear what we're trying to achieve and where we're going. The challenge is on the right-hand side, because under these conditions we just don't know. It's complex, it's interactive, too many elements to interact with one another. And this is very much the kind of space where a very different kind of innovation is needed. It's the space where crisis really matters as a force for innovation. Now let me go back to our earthquake for a moment and imagine what you could do and some of the heartwarming stories of powerful innovations which have emerged from that crucible, from that very difficult context. Imagine, for example, what you can do with a mobile phone. Now, we know what we do with mobile phones. We text, we send images, we even talk on them occasionally. But imagine in a situation after the earthquake, in a place like Haiti, where there was such a terrible earthquake in the early 2000s. What happened there very quickly was that people had access to mobile phones and started to invent very different ways of using them. Mobile phones, for example, not only have some kind of a GPS in them, so you can locate a phone, but you can communicate. So suddenly you can start to do crisis mapping. Where are the roads out? Where is there a particular concern? Where is there safe shelter? You can start to reunite people. You can use the phone as a communication device and link up families that have been displaced and separated. The problem of food. One of the things we've learned about food distribution is very often with disasters, the disaster might be quite local and there is food available as long as people can have the money and the access to the markets where the food is. And one of the things we've been doing for some time is giving people cash rather than food so that they can get access to the markets and get the food and other things they need for their families. Well, that's not so easy if your banking system's broken and the ATMs are in ruins. But again, what you can do with a mobile phone, something that was originally developed in Africa, is use it as a banking system. You can transfer phone credits and use that as a device for purchasing things. It's essentially an alternative, instantly available financial system. In so many ways, what happened in the Haiti earthquake and what happens in many crisis situations is that people on the ground in the situation act as entrepreneurs, they experiment, they change things, they develop solutions. Those examples were using mobile phones, but there are many other examples of innovations that come out of the crisis as a result of experiment and ingenuity. So, how would we work with crisis-driven innovation? Well, the first point to make is, by definition, that context is uncertain and complex. So it's going to need a very different approach. The dynamics of innovation are entrepreneurial. What we know about entrepreneurs is they cope with situations that aren't clear. They have a feeling, they have a flexibility, they're in the situation and they look for opportunities to do something in that situation. And particularly the tools they use, they try stuff out, they experiment, they prototype. It's a matter of probe and learn. It's not, I've got an idea and it will be this. Entrepreneurs are flexible. And it's exactly that kind of behaviour, that experimental behaviour, which is so important in those crisis situations. But there's a big challenge beyond that, which is how we move from the crisis, from the particular solution at the particular time, to scaling it up and scaling it out across, so that lessons learned in the Haiti earthquake could then be applied elsewhere. And that isn't simply a matter of plug and play. Let's take what we use there into another context. It's about configuring, adapting and extending. But that's part of the challenge as well, is moving from the specific crisis and the short-term crisis to something which can be deployed into the mainstream. Now, let me give you an example of how this played out for real in the context of healthcare. One of the problems, one of the crises, if you like, occurs around healthcare in emerging countries. Countries where there isn't a developed healthcare system, and very often there's no money and no skills to support a healthcare system. Now, one of the problems, obviously, in any human being have to do with eyes, and one of the very common things that happen to eyes is cataracts grow over the lens of the eye. And a cataract basically obscures the vision of the lens, and if you don't treat it, eventually you can't see through that eye. 2 cataracts and you go blind. Now, the good news for everybody is that we know a lot about cataracts and cataract surgery, and it's a fairly straightforward procedure to deal with that. Basically, the operation involves cutting out the cataract and the lens and replacing it with an artificial lens and allowing the whole process to heal up without infection. So the challenge really is no longer at the level of the concept, it's more how you might implement that in a different situation. And that's really where the crisis-driven element here comes in. A man called Dr. Venkataswamy worked his life as an eye surgeon in India. He worked in a big hospital in the south and he treated cataract patients. But his concern as a silver entrepreneur, so he didn't start this till he retired, was to try and take cataract care out of the hospitals which he was used to working in and to the villages, the poor villages of his native state of Tamil Nadu. Now, the cost of this operation is important. If you have it done, a cataract operation done in London, it would cost about $3,000. If you have it done in a big hospital in India, about $300. If you earn less than $2 a day, which is typical of the income of many Indians in the rural areas, you go blind. It's an economic crisis. How this challenge plays out essentially is people can't afford it, they go blind. It's a humanitarian problem. And Dr. Venkataswamy wanted to do something about that. So working in the context of that crisis, the first thing was to try and find an alternative solution. And characteristic of crisis, as I mentioned earlier, is you don't go down the established pathways. Your roads are blocked, you look somewhere different. So he knew he had to try and find a solution a long way from traditional healthcare. He'd set his target. He said, I could make this all work if I could cut this cost of operation from $300 to $30. But how do you do that? Well, he looked far and wide, and the great news is he found an answer. But not in the healthcare system. He found his answer under McDonald's golden arches. Now, whatever you think of McDonald's products, what they actually have produced is something which is fairly reproducible in all sorts of contexts around the world. It's the same model, same kind of thing. It's fast food of a guaranteed quality at a low price, delivered actually using systems which Henry Ford would have recognized. McDonald's really learned most of their lessons from the old Ford factories. And the idea of breaking tasks down into small chunks and training people well to do those tasks, the idea of keeping the focus on the specific task in hand and maximizing the use of the expensive machinery, all of these principles is what McDonald's applied from Ford and what Dr. Venkataswamy tried to do in terms of the Aravind approach to eye care. The stage of moving from the search to actually experimenting and prototyping, it took him a while. It was experimenting in context, huge amount of learning. But the result was something which worked in a very different way to traditional approaches to cataract surgery. The Aravind system may not even involve a physical building. It's going to involve very often a tent. It's moving the hospital where it's most needed. The patient is typically prepared, anaesthetized and sterilized by somebody who's just been trained in a very narrow set of skills. They're wheeled into the operating theatre where a skilled surgeon does an operation just as it would be done anywhere else. Take out the cataract, insert the lens, and then the patient's taken away to have the eye dressed and to be cared for so that no infection takes place. Again, by somebody who's been trained in a narrow set of skills. But one of the secrets to the Aravind system is high productivity. So no sooner has that patient left than another patient is wheeled in, the same operation. They leave, another one comes in. It's a factory for eye care. But it works. It works such that he's now been able to exceed his target. He originally wanted this operation to take place for $30. It now costs on average $25, which means that this operation can be done and can reach the people at in the target population, and many of the operations can be done for free, cross-subsidizing from wealthier patients. Perhaps one of the most important things, though, is it's not just about cost, it's also that the system works in terms of quality. The infection rates, which is a good measure of success, are better than many European hospitals. So you've got something there which Dr. Venkataswamy, first as an entrepreneur, developed, prototyped and pioneered, and now some 30 years later treats about 250,000 patients every year, to whom 20+ million people around the world owe their eyesight, who couldn't normally have afforded it. And it's become a system. It's become systematized, spread to many other locations, no longer just in India. It's a system which grew out of the crisis to become something standardized and mainstream. And not just scaled up, but scaled out. So the same principles that apply to eye care apply to all sorts of other kinds of surgery. Same lessons, same model. Perhaps for us, very significant, this is a radical innovation, it's a radical challenge, but it also might offer a very different direction for some of our own healthcare needs in the more developed world, where again we're concerned with the rising costs of healthcare. So, how do we work? How might we work with a crisis-driven approach? Remember, the key is that crisis forces us to think differently. If the old roads are blocked, we have to do something different. We then have to move first in an entrepreneurial fashion and then think about pilot, scale up and scale out. Well, the first thing we ought to do is to move the frame. If we stay within our safe, established frame, we're unlikely to experience the crisis and force ourselves to think differently. Interestingly, businesses get this. Hyundai, for many years in its shipbuilding division, had a process which they called crisis construction. They'd scare themselves into thinking radically differently. Shell has done this for many years with its use of scenarios, ways of businesses thinking the unthinkable, forcing them to move the frame. It's a starting point. And of course, you could find a crisis and see where and how you might solve those problems. One of the interesting things that Vodafone did in Kenya originally was to work with the challenge of a country where moving money around in the form of cash was not a very safe thing to do. People tended to get mugged. And so Vodafone helped develop a system called M-Pesa, which basically is a mobile phone-based way of moving money around. Now accounts for nearly half of gross domestic product transactions in this country of Kenya. And back to my Haiti earthquake, it was the enabling technology behind the mobile phone use there. So find a crisis and you might also learn from it as well, but it's unlikely to be on your doorstep. The next thing is to experiment, to explore, to probe and learn, to look beyond the obvious in the way that Dr. Venkataswamy searched far beyond the healthcare area to look for something very different. It's about pilots and prototyping, and perhaps one of the key things here is working with users, configuring things that work in that crisis context, meet the needs of users, mainly using their inputs to help create the prototype. It's the idea of co-creation. And finally, the challenge is to scale up and scale out to move beyond the mainstream. But the good news about crisis-driven innovation for the humanitarian sector is that it works and it generates powerful solutions which have saved and continue to save lives. But in a wider business sense, there may well be lessons from this model that we could adopt if we think hard about crisis-driven innovation.